Welcome to The Appetite, a podcast brought to you by Opal Food and Body Wisdom, an eating disorder treatment clinic in Seattle, Washington. On this podcast, we talk about all things food, body, movement, and mental health. I'm Dr. Lexi Giblin, your host for today, and I am the executive director and co-founder of Opal, and I'm a psychologist as well. And I'm very pleased to be here today with Meredith Blumenthal. Hello, Meredith.
Hello, hello.
Meredith is in private practice as a dietitian in the Seattle area, but we go way back.
We go way back.
Way back. So we first met when Meredith was a student in my abnormal psychology class at the UW when I was a lecturer at the University of Washington. And then Meredith was our administrative assistant at Opal for a couple years, was the most amazing administrative assistant, of course, for a couple of years till like around 2018. And then came back during some COVID times for internship with us for her dietitian internship work. And then was also in our milieu a bit then. And then went to Center for Discovery, worked there as a dietitian for a bit, and then into private practice. So I just think it's so cool that we're sitting here together today because we have all this history, and here you are in this new place in your life, and I'm just thrilled to be here and be able to have this conversation with you and have you share your knowledge with our listeners.
Oh, thank you. Me too. So grateful to be here. And yeah, fun to just kind of look back and see how both of us have changed from when we first met until now.
Yeah. So we were out to dinner a couple months ago and started talking just socially about GLP-1s. And I had a lot of energy about it, and Meredith did as well. So I said, we should do a podcast on this. This conversation should be heard by all. It's so good that others should hear what we're saying. So that's what started this idea of this podcast. And the other context I would provide is that last night, I've been doing some research on GLP-1s so I can move through this conversation with some understanding of what is being shared. And I got advertisements in my Instagram for GLP-1s for cosmetic purposes last night. And I thought, whoa, I did not know that the GLP-1s were being used like explicitly for cosmetic purposes for non-medical conditions. So that was a little shocker for me, and that they're now in capsule form as well. Yep. So Meredith, would you start by telling us what GLP-1s are?
Yes. Yeah. So GLP-1s were originally a medication created to target and treat diabetes, type 2, also just other metabolic diseases. And I think it's important to just note that today we are talking about GLP-1s in the context of weight loss, which they were approved for by the FDA, 4 years ago, I believe. So they're injectable medications, and they have kind of 3 mechanisms of action. They work on the brain, they work on the digestive tract, and they work on different organs in the body. So as I mentioned before, when they were developed for type 2 diabetes, the results that they were looking for were, blood sugar regulation. And so very much focused on, regulating the hormones that regulate our blood sugar. But because at higher doses, these medications impact the brain and the digestive tract more, they started using them for weight loss.
Okay. And so how do they work though? Because what about GLP-1s causes weight loss?
Yeah. So in the brain, they target hunger, satiety, and appetite. By target, I mean they obliterate appetite, especially at high doses. And then in the digestive tract, they slow the rate that food leaves the stomach. So when we talk about this medically, we call this gastroparesis, when food is moving slower through the stomach than it would, in a healthy digestive tract.
Okay, so then does that give more time for absorption of the nutrients in the food? Or why is it slowing down
Yeah, so
digestion?
the slowing down actually results in less effective breakdown of the foods that we're trying to digest and absorb.
Okay.
So typically we break down food in the stomach, and it makes it easier to digest the nutrients in the intestines. And so if we're not breaking the food down as well, we aren't absorbing as many nutrients as we would be otherwise.
Okay, I see. I was thinking maybe gastroparesis in this case would be an advantage to the human body, but it's actually not. It's okay. And it's so they're functioning to reduce appetite. They're not functioning to reduce the body's need for nutrition.
Yes.
Okay.
Yep.
So your body is still needing the same nourishment that it always has, but you just aren't hungry. You're not driven in the same way to feed yourself.
Right.
Okay.
Yes.
So I would assume that a lot of folks who are interested in taking GLP-1s are already interested in weight loss and are restricting their food intake already. And then they add this GLP-1 on top of that. So say a little bit about that.
Yeah, I am under the same assumption. And I think where the concern is there, aside from relationship to food, just physically speaking, the risk of malnutrition then is much higher if we have somebody who's already, skipping meals, and then we add on this medication that just crushes their appetite. We're eating even less, and we can see nutrient deficiencies. I mean, there's research. There isn't very much research yet, but there is research showing that people on these meds do experience nutrient deficiencies.
Mm-hmm.
Even similar to those in individuals with severe anorexia.
Mm-hmm.
And that's at any body weight, which I think is important to note.
Yeah. Okay. So it seems like the folks who would be interested in GLP-1s are likely could be at higher risk for eating disorders. Do you have a sense of how well that's getting screened for? Are we doing a good job of screening for folks who have eating disorders or disordered eating prior to prescribing GLP-1s?
In my clinical experience, no.
Okay.
I'm not, in the office with folks and don't have, personal experience with this. So I can't say for certain, but what I'm hearing from clients and when I do speak with their providers, oftentimes they're not aware that this person has disordered eating or, diagnosed eating disorder because they aren't screening.
Mm-hmm. So I imagine someone will present with binge eating in the medical office and concerns about weight, but maybe the medical folks aren't seeing how restriction is playing a role in the binging.
Correct.
Yeah.
Yep. Yeah, I think, again, the sense that I get from my clinical experience and anecdotally from folks who are taking these meds for weight loss is there is this experience of what they call food noise, quote unquote food noise. And food noise can be really different from person to person, but oftentimes it is described as constant thoughts about food outside of, quote, signs of hunger, right? And so if that's the personal experience of somebody who is binging and they come to their doctor and they say, I do well during the day and then at night I just can't seem to stop eating, that just the thoughts about food, the cravings are just there all the time. I think, unfortunately, because of weight stigma, and even in the primary care setting, and especially in the specialty setting, doctors are not trained to screen for eating disorders. And I think there's still a body type that prescribers or physicians attribute to certain eating disorders. So if you have somebody in a larger body that comes in with binge eating disorder, or just, maybe they're subclinical or whatever, they come in and they say they want to lose weight, and the provider just assumes this person just eats all the time. And like you said before, the restriction just isn't on the radar at all.
Mm-hmm. Right. Yeah. I imagine the person has attempted a whole multitude of diets over the years, and the prescriber would then just see the weight as the problem rather than the full weight cycling and dieting as the problem.
Yep.
Yeah. Well, and I can understand why someone would want to take a GLP-1.
Absolutely.
Right?
Yeah.
Our context is one of fat phobia, weight stigma, and a solution like this that's so readily available right at my fingertips in pill form now could potentially solve the problems that I'm having around body image and around the stigma experience and the discouragement I have around constant food noise and feeling out of control. So how do you think about that? How do you think about the fact that it makes this solution make sense for folks who are dealing with a great deal of suffering related to their food and body experience?
Such a great question that I think a lot of eating disorder treatment providers are wrestling with. My perspective on it is compassion. Like, I bring a lot of compassion to that experience for someone. I think we know, just as you shared, the size of someone's body could be extremely distressful for them, right? And there's the mental health eating disorder piece of that, but there's also the societal, cultural weight discrimination piece of that. And so when we have someone who's in a larger body and has gone their entire life experiencing weight discrimination and weight stigma in lots of different settings, especially the medical setting, it makes so much sense to me that this would just be this glittery, magical solution.
Totally, right? I mean, it makes so much sense that this would be a solution that many are turning to.
Mm-hmm.
And of course, even with the concerns that we're bringing up, it makes sense that folks would choose this for themselves and maybe just want to see how they respond. And I would say that Meredith and I would have a lot of respect for that decision, because no matter how we think about this, it's primarily we're interested in folks making the decisions they need to make for who they uniquely are and what they're going through in their lives at any given moment. And we can't know that. But I think our interest is more in making sure that there's informed consent, that there's more awareness about the risks and benefits that folks are taking on when they're trying out these GLP-1s.
Absolutely. Absolutely. Yeah, there are lots of folks that feel like weight loss is the only option And I think as long as they're aware of, the nutritional risks, the safety risks, the, questions we have around long-term use, then body autonomy is, what we need to center.
Yeah. Now, can I go on a GLP-1 for just a short time and then come off of it and maintain the benefits of my GLP-1 foray?
Such a great question. So I like to think about the GLP-1 short term as just like kind of going on another diet, right? So if what's happening is we're losing our appetite when we're on these meds and we're not eating it as much, intake goes way down, we see the weight loss, we come off the medication, the research we've seen tells us that weight regain occurs almost immediately, right? Which makes sense when you think about how the medication is working to suppress the appetite. Another thing I like to think about in this situation is when we don't have an appetite typically in the day-to-day world, it's often because we aren't feeling well, right? When we're really sick, when we're very ill, one of the symptoms of being ill is not having an appetite. And when we're feeling well, our appetite comes back, right? So that's kind of how I like to think about going on and off these medications. When you're on the medication, your appetite is down. When you're off the medication, your appetite comes right back. And when we think about dieting, if this, person has a history of chronic dieting, we have a lot of psychological deprivation in the picture and a lot of physical deprivation in the picture as well. And in the setting of psychological and physical deprivation, that quote unquote food noise gets very loud.
Right. It's trying to get you to eat, right?
Yes.
It's your body and mind's way of trying to procure food.
Yes.
Yes.
Yep. Turning on all of the parts of your brain that are in charge of appetite to do whatever it can to get you to eat.
Mm-hmm. So then with GLP-1s, to maintain the benefits, then you have to stay on them for the rest of your life.
Yes. Let me say what I hear from, clients and other providers is this idea that the GLP-1 isn't going to help you maintain weight loss long term. What is going to help you maintain weight loss long term is a lifestyle change. And so we have a lot of prescribers also saying, yes, this medication is a tool to use for weight loss, but it's not the be-all, end-all cure for quote unquote, obesity. It needs to be used in conjunction with quote unquote lifestyle changes. Right.
Right. So then, because the fantasy, I would think, is I'm going to go on this and spend the money on this for 6 months or so, lose the weight, come off of it, and then maintain whatever weight loss I have without any other changes. But the reality I'm hearing is much different than that fantasy. The reality is you're likely going to come off of those GLP-1s with powerful hunger I mean, because your body, would you say the person who's on a GLP-1 is starving? Is that too strong of a word to use?
I think it's individualized,
But they
but
could be.
they very well could be. Yeah, I would say malnourished.
Like
Yeah.
eating below their needs. So then they're likely to come off of the GLP-1s very hungry. I would think you'd be at much higher risk of binging
Yes.
as you come off of the GLP-1s.
Yes.
So I wonder if folks are not understanding that critical piece of information that you're discussing, that this is a long term, this is something that you have to stay on for long term.
Yeah, I wonder as well. I think that there are some prescribers that take surveillance and, check-ins seriously and do inform their patients about how to sort of titrate off of these medications to limit that abrupt appetite change. But I've also heard from, anecdotally that folks who've been on these go off them and then appetite is immediately right back, whether or not they titrated down, effectively or not.
Yeah. I've also heard, this is more anecdotally, I don't think we have the research yet to really tell us what the impact of these meds are long term. But anecdotally, I've heard of folks who are on GLP-1s and they lose weight initially, but then the weight starts to come back on, even though their food intake is the same, similar to what it had been, like almost like their body is doing the thing of adapting to starvation and holding on to the calories it does get. What do you know about that?
I don't have any clients who've experienced that. I have, again, anecdotally heard this same experience. And I think it's another concern because it's a good example of how we, the public, are not being exposed to all of these varied experiences that folks are having. Some folks, GLP-1s are not effective for weight loss. They just aren't. Or maybe one type will be and another type won't be. It's almost reminds me of sort of, the search for the right antidepressant or anti-anxiety medicine, right? But what we see in social media is the folks that are posting the before and after pictures and, all these online clinics just offering this solution. There's no discussion of, these medications not working the way that they're being advertised.
And so then the other piece that is maybe not understood is that these meds are kind of functioning in a similar way as a diet, as you said. And so then I'm assuming that weight set point will change after coming off of GLP-1s. Can you say more about that?
Yeah, so let me start by just sharing set point theory. So there's a research-based theory called set point theory that says that when we go on a diet, our metabolism slows down, right? And when we come off that diet, our metabolism might speed back up, might become more efficient than it was when we were dieting, but it likely doesn't become as efficient as it was before we went on the diet. And your body adapts to keep your weight stable again. after the diet, because it's like, whoa, I was just starved, and we're not going to let that happen again. And so we often see weight increase after a diet. So weight is higher than when the person went on the diet in the first place. And we call that kind of new weight the set point. And so as we see dieters diet over and over again, we're seeing this sort of weight slowly creep up over time, because the theory is that set point moves higher.
Okay. And so GLP-1s would be just similar to a diet in this way within this theory. It's eating, they're prompting you to eat less,
Yep.
and just like a diet would.
Yep, exactly.
Yeah. Okay. And then I know I hear a lot about the muscle wasting aspect of GLP-1s, and I've been curious about that because I guess my curiosity is around how GLP-1s would target muscle over fat in the body. Like why is muscle such a target of the weight loss that folks are seeing with GLP-1s?
Well, I think in general that when we restrict our intake, when we're giving our body less than it needs nutritionally, muscle is easier for the body to access for energy than fat is, especially in people who are assigned female at birth. So if we're not eating enough, and on top of that we're not eating enough protein, and on top of that we're not doing any kind of physical activity that would build muscle, we are much more likely to lose muscle in addition to some of the fat, right? So it's easier for the body to access as energy.
Okay, makes sense. So then that makes me think about like a harm reduction approach related to that is maybe could you talk a little bit about harm reduction, maybe as it relates to the muscle loss?
Yeah, absolutely.
Because I imagine there's lots of folks out there who are wanting to try this, which is understandable. It's very compelling. And if a person is going to choose to try it, maybe there are some ways to protect one's health as they investigate the experience of being on a GLP-1.
Yes, 100%. So in regards to the muscle piece, I think a tool that unfortunately is expensive but can be really helpful to use is a DEXA scan, or there's something called the bod pod. So you're actually tracking the composition of your muscle tissue and fat tissue. So if we're wanting to prevent muscle loss, that's really the best tool to use to track whether or not we're losing muscle. And then we have changes we can make in the diet, right? Making sure we're getting enough protein and making sure that we're engaging in some sort of movement that is muscle building, right? That doesn't necessarily have to be weightlifting. I think that's what people think a lot of the time, but any sort of resistance exercise. I mean, yeah, even some yoga, is body resistance exercise. So those are kind of the two treatment strategies.
Like just what you do eat, making sure you're getting enough protein in that amount that you are eating, and getting and working on strengthening exercise.
Yep.
What else would you say is important to consider if you are wanting to reduce the negative impact of being on a GLP-1?
Yeah, I think, in eating disorder treatment, we talk about mechanical eating a lot when folks are first starting out to help them get through this, increased nutrition stage of treatment. And similarly, because when you're on a GLP-1, you lose your appetite, using structured eating by setting like a timer, you could even call it time scheduled eating, can be really helpful, because regardless of whether or not you're hungry, you still need to eat, right? And just having that reminder, having those alarms, building that structure into your day can really support making sure you're getting enough such that you're not malnourished. I also would say that I think it's quite important, obviously I'm biased, but to be engaging with a dietitian regularly. I think having somebody who is a nutrition trained professional to oversee and kind of check in and make sure things are going well, even perhaps to help you manage some of the side effects, is really important. I think included in that could be routine lab work you could do with your prescriber and work in tandem with the dietitian to make sure we're keeping track of any deficiencies that might be coming up. And especially if we have an eating disorder or history of an eating disorder, making sure there's a relapse prevention plan in place.
Yeah. And I wonder if we might, at this point, it seems like, eating disorder treatment professionals are not quite yet sure where to place GLP-1s. Are we, some of us are thinking of it as a symptom of an eating disorder. For some folks, like, this is another attempt at managing weight. Are GLP-1s just another eating disorder symptom, an important eating disorder symptom, and a sign of an underlying psychological vulnerability? And it seems like, as you're saying this about clients being thoughtful about seeing a dietitian as they're on GLP-1s, I also think about the importance of seeing a therapist while on GLP-1s, particularly if there's vulnerability history of an eating disorder. At this point, it seems like it's being presented to us, GLP-1s are being presented to us as if they are not a diet, as if they are not an eating disorder problem. But for those who are vulnerable to eating disorders, I would say this would be a great time to be in care with someone. And I worry that folks are going to feel not as willing to go in to see therapists when they're on GLP-1s, their eating disorder therapists when they're on GLP-1s. And I hate that. I hate that idea that people would be foregoing care out of feeling concerned about judgment from eating disorder therapists. So I want to encourage folks to find those therapists that really put your body autonomy, your informed decision making as the priority, and can support you in the decisions that you're making and allow you to kind of lead the way in your decision making and support how you kind of want to live your life and not have an agenda that overrides your own decision making.
100%. Couldn't have said it better myself. And I think to the eating disorder providers out there, just to be mindful of, where your personal values lie around weight and weight loss, and, compassion for and empathy for and body autonomy for clients, and really trying to weigh those out, because I could see somebody having a difficult experience if the provider isn't, open to or willing to make space for that choice.
Yeah.
Yeah.
And so from an eating disorder therapist's point of view, I think it is helpful to think of it as an eating disorder symptom, because of course we're regularly as therapists, helping clients navigate their eating disorder symptoms. So it's very easy to use that frame when it comes to GLP-1s. if indeed that is the case for a client who has an eating disorder. I also, you were talking about harm reduction, and we were talking about therapists and seeing therapists and dietitian and kind of ways in which you can treat the muscle loss potential, get protein in. And I'm also thinking about how food relationships are so much more than just fueling the body. And so
Yes.
what can you imagine that we can do to sort of reduce the harm that not eating as much would have on our lives?
Yeah. I mean, you just make me think of actually an article I read in the New York Times where it's a person who's been on a GLP-1 and they talk about their experience eating out socially with friends. And I kid you not, I read through the article almost every time the person said, I'm on a GLP-1 when they were kind of trying to navigate social situations. They maybe say to the waiter, like, because they've only taken, 10 bites of their meal. Like, don't worry, I loved it. I want to take the rest to go. I'm on a GLP-1. Like, anytime that was in the article, my brain was like, that sentence could be replaced with, I have an eating disorder, which is just like heartbreaking. But I think you make a really great point that, of course, eating is not just for fueling. Eating is tradition. Eating is culture. Eating is social. And
celebration.
yes.
I just think of that, like the excitement of, oh, let's go out for this dinner, together to celebrate this big thing, or let's have, this yummy dessert out of celebration, and not having access to that pleasure. It's like almost, maybe we could think of it that way, is you're blocking pleasure.
Yeah. 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 And then oppositely, you have folks who have binge eating disorder, and, sometimes there isn't restriction present. I think that that's a lot less common. But sometimes, I have heard this anecdotally from folks or from clients. And so that's this, it's like they have the opposite experience where they're like, oh, this is such a relief that I'm not, so out of control around all of these foods, and maybe even gives them some space to start to, work on more of intuitive eating. I mean, this might sound wild, but I have heard of this happening to clients through
Where
other providers.
where the food noise decreases, you then have more space in your life to access things you love in life. You're not as compelled by food.
Yep.
And therefore have space for other things. And how would intuitive eating work, though, if you're not feeling hunger?
That's a great question. I personally don't know if those two go together. If no appetite induced by medication goes with intuitive eating. I think they're opposites. And, I have heard other providers share about client experiences where folks with binge eating disorder do feel like they could be more in tune with their body because the food noise is less.
Yeah, that makes sense.
Yeah.
That makes sense. And I talk about, I said the pleasure of food. And of course, I understand that not everybody has pleasure with food. And food is, as I very well know, is fraught with pain and guilt and sadness and anger and all of the most difficult, and shame. I shouldn't leave out shame, right? So to not have to interact with food can help a person stay away from those really difficult emotions. So I get it. It's a tough one. I worry about the long-term consequences. I can totally understand why folks would be interested in giving this a go. And I worry about this digging folks into a deeper hole than they were to begin with after coming off of them.
Me too, especially if they're not prepared to take these medications for the rest of their life.
Yeah. The GLP-1 seems so accessible. And I know I've been getting, since working on this podcast, I've been getting an abundance of GLP-1 advertisements coming my way. And I'm shocked by how easily accessible they are.
Yes, it's pretty incredible that there are tons of online clinics. You mentioned the oral option, which isn't FDA approved yet for weight loss, but it's sending you ads so you can get it somewhere, right? I think just the accessibility is a good example of some of the risks that we want to make sure that we are aware of safety-wise. Some of these medications might be, this sounds a little paranoid, but some of these medications offered by these online clinics could be counterfeit, right? These online clinics often lack quality control. They're potentially offering, dosages that are different than what's on the label, right? They're maybe coming from overseas. There's this lack of regulation around what they call the gray market kind of access point for these medications that does significantly increase the risks of taking them.
Well, we'll see in the coming years where this all goes. But what I feel sure about is that Meredith will be available to help folks as they navigate these waters, and Opal is always available as well to help folks as they make these difficult decisions around how to navigate the feelings that are coming up around food and body, and whether GLP-1s may be an appropriate next step. I also encourage listeners to go back to episode 132 with Dr. Lisa Erlanger. She talks about GLP-1s with Julie Church on that episode. So I love this, Meredith. Thank you for coming in and sharing your knowledge and spending some time with me. It's fun to interact at yet this another stage of life and another stage of our careers. So very fun. Thank you.
Yes. Oh my gosh. Back at you.
Yeah.
Just another iteration of you and me.
Yeah. Here we are in a studio. All right. Thank you to Jack Straw Cultural Center for sound engineering. Thanks to Aaron Davidson for the Appetites original music, and to David Bazzi for editing. If you want to learn more about Opal's programming, go to opalfoodandbody.com. And if you want to talk with Meredith in her private practice, you can go to nutritionwithmeredith.com. Until next time.